Minister. I just want to ask you, can you tell me about how the Patient Advocacy Service came about and what you did to establish it?
So the Ombudsman and HICWA and others have recognised that there is a need in Ireland to have a confidential, independent patient advocacy service. And I'm really proud that my department is in a position to now fund this service, that it's now up and running, that there is a free phone number that people can now call, and crucially that they know at the end of that phone, the person answering their call has a qualification in patient advocacy, is studying in patient advocacy and has achieved a certain standard, so they can help them navigate their way through the health service at what could be a very difficult and vulnerable time. So I do think this is a potential game changer when it comes to patient advocacy in our country.
What did you do to establish the service? What did the department have to do in yourself?
So I want to thank the department for the work that they did in terms of going out to tender, in terms of providing an open competition, and then obviously awarding the contract for the next number of years to our National Advocacy Service. It's a huge amount of work that has been done to arrive at this point. But now the service is up and running, and I would encourage people to familiarise themselves, go to the website where you can find out more information, or indeed if you require the service, to call the free phone line.
And what are the benefits to patients of the new service?
I think when a patient finds themselves in a situation where something has gone wrong in the health service, or where they have a query in relation to a complaint they wish to make, often it can seem daunting, particularly at a time of vulnerability. And the idea that you would have a professional who can help you navigate that process, can provide you with advice and information, and can help maybe streamline the complaints process for you, I think is a huge benefit, and I hope a source of comfort to people in terms of knowing that their voice is heard at the very heart of our health service and that lessons are learned.
And what will it mean for the health services as a whole and for the staff?
So I really would encourage, and I know the health service will embrace this, because any successful resolution of a complaint involves two willing partners. We need to embed a culture in our health service where when something goes wrong, people put up their hands, say yes, a mistake was made, they sincerely apologise, and they make sure that lessons are learnt in that regard. We need to create that open culture. And I think from the point of view of the person working in the health service, knowing that there is an advocacy service that can help, again, process the complaint, bring the information to the health service, I hope will streamline that process too.